Well, if you haven't gotten the flu this year, you're not alone. Health officials say BC is experiencing the lowest influenza season in about a decade, and our warm weather is helping reduce the flu's impact. Kristen Robinson has more.
So you see this part is black and this part is white.
These kindergarten students at Rogers Elementary are spending a lot more time in class. Their school is just one of many in the Greater Victoria District where learning is getting a boost from a very slow flu season.
Yeah, we're not seeing a rapid spread of illness this year as we have in the past. What we're seeing this year is 1 or 2 children per classroom being ill, as opposed to in past years we would see 3 and 4, maybe even upwards of 5 and 6 at a time being ill, and this year it's definitely reduced.
There has been a decrease in student absences. There's also been a decrease across all our employee groups in terms of employee absence as well. So we're certainly experiencing a healthier school environment than previous winters.
Experts say our warmer winter is one reason fewer people, including school children, are getting sick this year. Since influenza spreads when people congregate inside during colder weather, the mild winter is helping to reduce the flu's impact. BC's Centre for Disease Control says flu activity is at its lowest level in about 10 years, while U.S. health officials say in the 29 years since they've tracked the flu, this is the slowest ever start to the season.
We're almost burning these viruses out now. We've had the same flu viruses around for quite a few years now, including the one that we saw that caused the pandemic. So many people are immune to them already, and they're also well covered in the vaccine.
Vancouver Island did see a spike in influenza A cases in early January, and there have been 6 flu outbreaks at long-term care homes, the most in several years. Yes. But even pharmacists say it's been slow going, with fewer patients asking for flu advice.
You also get a feel for the number of prescriptions of oseltamivir or Tamiflu, and I think I dispensed 1 prescription this year of Tamiflu. But the number of calls from patients, what I think lower than I would have expected or have seen in previous years.
Most of his 700 private and public flu shot doses were used at clinics, but he still has 9 doses of flu missed, a $40 intranasal vaccination, which some may want to consider to shut the door on what could be a second peak of influenza B in March.